I'm Dr. Mark Goodfield. I'm a consultant dermatologist and I work at Leeds General Infirmary in the skin department there. And we were having a psoriasis is a complicated disorder. It's genetically determined but in a rather complex way. So there's no simple pattern of inheritance, but within a family you will often find a number of family members who are affected. The disease is very easily recognised. And particularly in those common areas, elbows, knees, scalp, the main features of the disease are its redness and its scaliness. Skin disease in general has a much bigger impact on quality of life than people often recognise. And psoriasis is one of those conditions that's right up there at the top of disease impact, partly because it's visible. And if you have psoriasis affecting your face, for instance, that has a very major impact on what you present to the world. It isn't catching, although there may be other members of your family who have got it, you can't give it to them and you can't give it to partners or to friends. The treatment for psoriasis, as with any skin disease, starts with simple topical treatments. There are also quite old-fashioned things like tar preparations, which are okay. They're a bit messy, a bit smelly if you don't like the smell of tar, but they do have a role in psoriasis. The next conventional thing to do when patients come having failed topical treatment would be to give them some ultraviolet light therapy. The big risk associated with ultraviolet treatments is that we undoubtedly increase patients' risk of getting a skin cancer through their lifetime. And the more ultraviolet we give, just as the more sunlight you get, then the greater your risk of skin cancer is. If you don't do well with ultraviolet light, then we would move to a tablet treatment quite quickly. And by not doing well, what I mean is not responding, because almost everybody responds when we give the treatment, but is relapsing quickly when the treatment stops. Somewhere between 10 and 25% of patients with psoriasis will have significant joint problems related to the psoriasis directly. Now a whole new group of drugs that are available for the treatment of psoriasis and arthritis and some other conditions. These are called biologics. They are, well, broadly antibodies directed against the chemicals or the cells that make the inflammation happen in the skin or in the joints. They're given either as an infusion, a drip, or as an injection, and the injection treatments are given once or twice a week. The drips are given at intervals of anywhere between 4 and 8 weeks, depending on how bad you are and how well they work. Psoriasis is so unpredictable that quite often it will just resolve. Spontaneously, it'll go away. And that does happen to a proportion of patients. But it's just accepting that psoriasis is not a disease you want to get. But if you have got it, at least we now have a lot of treatment options for you in a way that wasn't the case even 10 or 15 years ago.